Garg, and all the participants here today, people who've taken time out to attend this meeting. I also would like to give a brief introduction of FACEMI here. FACEMI was founded by Dr. Nirmala Srinivasan, and it operates at a pan-India level to ensure optimal scope for the delivery of psychiatric services provided by the government, particularly those in urban metros and cities. We operate as a community of family volunteers working for the wellness, security, and dignity of our loved ones under treatment for mental illness. I would just like to add at this point of time that all the participants can write their questions after Dr. Garg's presentation in the chat box, and I will be reading out the questions to Dr. Garg, and he'll be answering. Kindly keep yourself on mute at all times unless you have something specific to ask. But I would like you to raise your hand, and only when you're called, kindly unmute yourself and talk. It gives me pleasure to introduce Dr. Garg to all of you. A very brief introduction to our esteemed speaker today. He is a professor in the Department of Psychiatry in the Sri Guru Ram Rai Institute of Medical and Health Sciences. He is in charge of the neuromodulation at the hospital. He is also the chairman, a research review committee. He is an associate editor of the Archives of Biological Psychiatry. He is the president-elect of the Himalayan Psychiatric Society. He is chairman, Neuromodulation Committee, Indian Psychiatric Society, convener of the Social Media Subcommittee at SARC. He is co-chair IPS Suicide Line from 2020 to 2021. He was the past secretary 2017-2019 Himalayan Psychiatric Society, past convener of the Social Media Cell in the Indian Psychiatric Society in 2020, Executive Council member IAPP UP UK. Dr. Garg was the Executive Council member of the IAPP UP UK and the member of editorial board IJPM reviewer in various national and international journals. His main areas of interest are bipolar disorders and brain stimulation. He has several research and publications to his name. So without taking much time, I would like to hand over the session to Dr. Garg. Hello. Yeah. Sir, please, you may start your presentation. Thank you for being here with us today.
Yeah. So I think good morning, everyone. It's my pleasure that I've been invited in this esteemed forum to talk about a very pertinent issue. First of all, I would like to bring it to everyone's notice that family wellness is the way ahead when we talk about mental wellness. And I think I'm very, very happy that this organization has taken its due course, and I think it is very exciting to be part of this esteemed forum. What I have when the organizers ma'am Sindhuja ji and Saraswati ji were in touch with me what topic to take up. So I thought that rather than talking about routine issue like stress management or depression, anxiety, why not take it up something which is very interesting in a way that we can relate to it, and it is something which is, we call it as behind the scenes phenomena is there. Everyone is comfortable in English, or shall I use my vernacular language here?
So usually English is good. If there is a need, because many of us are also from South India, sir. So
Okay.
a little bit of Hindi here and there is good, but mainly English, sir.
Oh, wonderful.
Thank you so much.
Shall I share my screen?
Yes, sir.
Okay, thank you. And is the screen visible?
It's still going. It's visible, sir. Thank you.
So, without much ado, I'll like to just dive into this very, very interesting phenomena with some disclaimers. I don't have any conflict of interest. The videos I will be showing some videos which have been taken from public forum, which are available for use, and I think it is subsequently for public awareness use. Why are we talking about adult ADHD? So we know that I hope everyone is well versed with what is ADHD. So I want response in the chat box. That is why I've logged in from a different device to just see, and I want everyone participation in this. That is why it becomes interactive. So does everyone knows about what is ADHD? So there are two responses. I don't know. Adulthood, adult ADHD, yes. Tanya Ji saying yes. Indrani Ji is saying adulthood, yes. Attentional deficit disorder, yes. So Suresh ma'am is saying yes. Sindhuja ji saying attentional deficit disorder. So we know the full form. So I think with after this presentation, we'll be clearly knowing what is ADHD. When we see ADHD from perspective of a child, so what comes in our mind is, okay, child is robust, not able to sit in one place, is very fidgety, is jumping around on the go, having some kind of a like some motor has been fitted inside the child, and barging the objects, falling frequently, full of energy, not getting tired, not able to sit in one place, whole lot of attentional issues, would daydream, would get lost in the background. So when we talk about children, we have this kind of an picture. So that exactly we mean by ADHD, creating problems for the child, not able to let child have educational goals. Like he'll not be able to attain educational goals, and the okay, so Aditya ji is saying hyperactivity in adult age. I can only focus for 20 seconds maximum. Wonderful, Aditya ji. Okay, attentional and emotional regulation in adults. I think we're very learned audience here. So I'm very happy. So when we see any diagnosis of mental health, we only give when there is a dysfunction in a lot of domains. So not only in one domain, more than one domain, like educational domain, domain in making friends, domain in interacting with social situations. So then only we say that something is a problem. But in context of adults, the prevalence is very vast range is there, but every four of out of 100 we suffer from adult ADHD. So I think in audience, how many strengths we have?
26.
Very
20.
difficult.
25, including you,
Okay,
Yeah.
so
26.
around five of us, or maybe six of us, must be having diagnosable ADHD. And ADHD doesn't, come alone. It actually arrives with its own baggage. The train comes with a lot of compartments, I would say. So generally, isolated ADHD is only one quarter of them. It comes with other psychiatric illnesses like depression, anxiety, so on and so forth. Now, I want the responses. How much do you know about ADHD from scale of 1 to 10? A lot of people said me that they had shared the full forms of ADHD from 1 to 10. From 0 to 10. 0 is you don't have any knowledge, 10 is you're expert. So how much do you know about ADHD? Kindly just share your scores. Aditya ji is very well versed. So Aditya ji and me will have a lot of conversations. 4, 2, I have met a child who had ADHD. 5, 8, 6. Okay, any other responses? So 0, pretty honest answer, I suppose. Ramanji. So I think an average my son might have, yes. So after preparing this talk, I felt I also have some ADHD, sir. Ekta ji is one. Okay. So my point is average. Everyone is having average knowledge and understandings of ADHD. So good to go. Anyone in your close circles suffering from with ADHD? Yes or no? I think a lot of people have answered that indirectly, that some children might be having uh, someone has met a child with ADHD. So, so do you know anyone having diagnosable ADHD, diagnosed by some of the mental health expert? Okay, Tanya ji's daughter. Okay, I know a member who has adult ADHD, Sindhuja ji. Okay. Okay. Let me go to the next question. Are you the organizer in the family? So I'll also reply. So my reply is no. I'm not the organizer. My wife is the organizer of the family. Are you the organizer of the family? Yes, yes. Female preponderance, probably an alpha bias will be there. Aditya ji saying no. Who would get engaged in organizing stuffs and routines? People who have just joined, we are just doing some kind of an question answer survey here. And why I'll do this, I'll let you know. Indrajini is saying yes, she's the organizer of the family. Anyone else? Any responses? You can say if someone is the organizer, they can just write yes. Otherwise, no. Okay. I'm going to the next question. Do you often procrastinate? Do you procrastination means do delay the task till the deadline will come at your head? So one response is yes. Ramanji says no. He is to the point. Sometimes situational, not always. So maybe sometimes you do, sometimes you won't do. Mostly, often she is the organizer of the family. At present, coming out of it after talk therapy. Okay. Sometimes Lalita ji says yes. Sometimes depends. So mostly I procrastinate. But procrastination is not the only symptom. Do you often daydream? Going to the next question. Please be please be fast. This may be a fast finger first kind of a thing. No. So there are answers is yes. Daydream, losing yourself into कि क्या करेंगे, क्या करना था, क्या हुआ था, those kind of things in the past, present, or future. You're not there. So I think less responses I've got with daydream. So people are probably dreaming now. Daydream with my mama. Mama. Okay. Okay. So daughter and mother are daydreaming together. Okay. So I'll come to this couple phenomena. I'll come to this. It's an interesting one. Okay, do when you have a task that requires a lot of thought, how often do you avoid or delay getting started? I'm not talking about procrastination per se, but when you are occupied, do you delay the starting of a task? And I have given a range of numbers from the 1 to so never, rarely, or sometimes, often, very often. So this is the numbering. You can just write your answer. Rarely. So rarely you'll avoid or delay a task. Yes, heavily. Aditya ji says heavily, rarely. Again, mixed response. Most of the time, I delay such tasks. Delaying till it is on your head or it is on your shoulders. Okay. So Ekta ji says most of the time I delay such tasks. Okay, let me come to the next question. This is important. How often do you make careless mistakes when you have to work on a boring or a difficult project? Not much. So careless
Sir,
mistakes.
please repeat the question.
Do you often make careless mistakes when you are working on a boring or difficult project? Either it is boring, it is not stimulating you, or not exciting you, or it is difficult. It gets the brain gets overwhelmed. So, do you make careless mistakes in that context? Sometimes there is answer is no, no. Sometimes. Any other question? So everyone, mostly people are not making careless mistakes when it is boring. But will you find it this lot common with the kids, despite knowing the mathematical formulas? somehow they'll make those same mistakes again and again, despite putting into their head that you will not do it. This is pretty common with I used to in the mathematics, yes. So there are a lot of mathematics struggles here. How many you struggle with multitask? One of the responses I just saw with multitask. So multitasking means maybe more than one task, parallel tasks doing together. Like I'm reading the chats, conducting a session, maybe a patient's phone will come, I'll pretend that maybe an emergency. So how many of you will struggle with multitasks? So, or enjoying multitask, yes, we'll come to this later on. I cannot multitask, Ramanji is saying, not much. Can multitask. Multitasking in the morning hours probably okay, but either as the day goes by, the fatigue increases. So whether multitasking becomes difficult as the day progresses, this is also interesting in ADHD. In ADHD, you might struggle with multitask, but maybe in later part of the day. Okay. How often do you fidget or squirm with your hands or feet when you have to sit down for a long time? So Aditya ji saying yes, fidgeting, moving your legs, squirming, tapping your legs like this, or maybe a lot of fidgeting, moving in and around the chair, rocking kind of a thing, and finding the good space little difficult. So Aditya ji is saying you're moving legs, feet a lot, little when it is of not of interest to me. So probably, and obviously this would increase when the brain is not focused enough, or you're engaged into a difficult task which is more overwhelming than what you can do, or maybe a boring task. Fidget with phone, that is interesting. That is interesting. Any other responses? I think we have 30 odd audience. So we, 4 5 people are pretty, so eating friend's brain. So that is interesting. Okay. How many of you are not getting a kick out of things? So maybe doing the same thing, maybe doing the activity, a same activity, or maybe doing the same schedule daily, so it stops giving the kick. You lose out on the novelty of the daily activities. How many of you? You can say yes or no. Ramanji is saying I'm lazy at times. So getting the kick, getting the dopamine, getting the pleasure. Like I'm going to see patients every day. So whether I lose out on the novelty of it. So I think we didn't have much responses. So would you get easily distracted by a thought? Now this is important. Easily distracted by a thought, what do you exactly mean is ki you're in sync, you're doing well, a thought comes and it actually drags you out of your mental space. So it's like taking one person, like maybe a Venezuela president was absconded, was taken up by the US from Venezuela. So something of that sort. So it takes you out from that moment and then you're completely off the track. This kind of thing happens. Yes, distraction is a problem. No, sometimes. And if it is often, then it is an issue. Yes, get distracted with thoughts, and thoughts take you out of this space. Then you're not able to come back. Situational, yes, often. I think quite a few interesting responses we have got. Aditya ji is saying even now. So it is probably my question has cued him, and he is having a distractible thought. So do you often fail to finish tasks when started? So it is not about procrastination now. With very, very difficulty, I have started a task. Now I'm not able to finish it. I start a task and it fizzes out. The novelty fizzes out in between. I don't have any persistence to do the task. I don't feel like I should continue. There are a lot of students who come to us with a lot of career options. The issue is that they choose so many career options in over a very small period of time, and then they when they enter into the course, the novelty goes off, and then they would want to discontinue the course. Probably there the problem adult ADHD lies. So this is important. Do you miss your starting reporting time in your work? So I requested the organizers, please start everything by 11 a.m. sharp, because I'm very, very particular about time. So do you report reporting time? Like our hospital time is 9 a.m. So do I generally don't miss it? What about the audience? I am always before time, Ramanji. So this is good. Yes. So reporting time. So you miss reporting time. Indrani ji has shared other responses. No, because one of my friends who's a psychiatrist, he will not report on time. But in last 10 years, he's along with me, and never one day has reported on time. But by the evening, he's always on time. Okay, Sindhuja ji says, so those people who join before time, they're anarchistic personalities, I must say. The harm avoidance is very high. So they do not want to, and probably the moral consciousness is very high. How many of you act without thinking? Impulsive. सोचा नहीं कर दिया. Ekta ji is saying I'm usually late by a few minutes. Responses to this question is yes. I think two, always on time because I'm socially covered basically and fear the consequence of being late. Okay, I think we have come to the next few. So there are few impulsive qualities in the audience. Three responses I've got where people act without thinking. क्या होगा छोड़ देंगे बाद में सोचा जाएगा. We'll brood on it later on. Let us delve onto this. Okay. Do you have difficulty getting awake? In continuity of the previous question reporting, but whether are you poor in getting awake? So you sleep probably on time, but you are not very good morning persons. No. No, so because my friend whom I was discussing, I will generally do not talk to him till it is 4, it is 12 p.m. or 1 p.m. After this, he is a wonderful human being. But in the morning, if you call him, you will generally the manner of conversations is very brash. So, morning, are you having difficulty in getting awake? This is also one of the soft features in adult ADHD. This is important. How many of you had trouble with authorities, trouble with schools, visits to principal office? I think let us dive down to the past. Okay, I always had. Aditya ji has had. Never, not me. No. Anyone who has had issues with the repeated, recurrent issues with the authorities? No. It's a very disciplined population. The audience we have. This question, do you often have problems remembering appointments or obligations? Yesterday we had a meeting with Frontiers. So I remembered my two other co-fellow faculties, they missed that appointment despite the reminders. Okay, so yes, because of my queries raised, Indrani ji, I'm not very clear what you want to put it across to here. So no. Yes, so you miss the reminders of appointments or obligations. Nowadays, I tend to forget, so I use my calendar. Yes, using calendar will come to this sometimes. Okay, so we will come to the next question. Do you have difficulty concentrating on what people say to you, even they are speaking to you directly? Now, interestingly, I had one resident who was my student in our PG program, PG postgraduate psychiatry program. Whenever I used to tell him something to or correct him, I used to think that he was looking through me. So his eyes would look through me, but he will be looking at probably something behind me. So we call it see-through phenomena. And actually, he is not there. He is gazing towards me, but he is not listening to me. So then we found out that he was having ADHD, was so distractible from inside. So whether this phenomena happens, no. So when you're talking to someone, suddenly your concentration snaps off, and then you are focused on something else, but looking directly to the person. So why this question is interesting? Because if you see, you can detect a lot of your family members or colleagues or friends having the same phenomena. बात करते करते, while talking, while having conversation, the concentration gets off. They get distracted. So yes, because why I've used it, because you can say it as a distraction, but I'm just trying to give it a different meaning altogether. Coming to distraction, how often you're distracted by activities or noise around you? Trivial noises would distract you, or you are able to filter it out to maintain the activity. Well, as you're attending this webinar, so some trivial noises around you, would they disturb you, or you're able to filter it out? Those, because every one of our brain has a capacity to filter out some of the noise actively and give us a sustained attention. We call it focus attention. So social media phone is distracting. Yes, absolutely. Yes, it disturbs. So quite a yes. Answers yes. Any other response? Sometimes I get disturbed by people clutter. You get disturbed. So Diktaji gets with casual chit chat. She gets disturbed by that. Okay. When you are in a conversation, how often do you find yourself finishing the sentence of the people you are talking to before they? So how often you're in a conversation where you find yourself finishing the sentence of the people you are talking to before they can finish themselves? So basically, you are not able to regulate and not able to regulate and wait for them to finish, and then you are finishing the conversation for them. Never, sometimes with some people, many times I do that. With some people, I do. And I was surprised. There was a document where addressing the human communication, where they said that there are 7 or 8 different ways to end a communication. That was pretty interesting, but that is not the context of this topic which we are addressing. Maybe we can do it sometimes later. Okay. How often you are distracted by a thought? I think we have addressed this. We have addressed this. We probably it's a repetition. So most of the questions which I had asked, few of
Sorry
them,
for the interruption.
yeah,
I have a doubt here.
yes,
Said
ma'am.
thought which is distracting you. Sometimes is distracting means is it in the negative way or positive way? Sometimes distraction is also a happy feeling, right?
I think a very important point, very subtle point you have made here, because distraction in context of an activity which you are doing. So I am taking a webinar. So if I am distracted by a thought, either it is a positive or negative, which takes me away from this activity. So in that context also, so daydreaming is always, it can be pleasing also. Like if you take an example of daydreaming, so many people are happy while doing daydreaming, and many people are also distressed by doing daydreaming. So thought can be pleasant or unpleasant, but in context of the activity, respected activity, if it is taking us away, so that I want responses. So that's called ruminating thought, I guess, negative thoughts. Yes, rumination, we can discuss exactly what is rumination. But here we want to say that you are involved into XYZ activity and you have been distracted by a thought away from that activity, and then it takes you into some other space. And then the person who is looking onto you feels that you have gone into some other space. You are not concentrating on the moment, of probably having see-through kind of a phenomena. So everything is connected here. So my point is, whatever questions I had put up, so these in togetherness and few more stuffs which I'll be discussing subsequently are a cluster which we call as adult ADHD. So many of you might feel that okay, so you might question, ki I'm okay, I am having ADHD. Okay, some things sometimes I am having ADHD. So you have to remember that attentional deficit as a trait means as a quality. You can take it as a negative quality. So it is pervasive in all the people. So we all have some or the other degrees of attentional deficit traits. There are scales which can help you to quantify for your respective people can quantify yourself. But when we call it as a disorder, we have to see that it has to cross a particular threshold. So you can see just few videos I've put up just to break the monotony, how ADHD looks like. Top 5 random things you do in public. So they'll walk very fast. So they'll enter into the party, will blast everything and then leave it early, bumping into the people. So it's a very just to break the monotony. This is the criteria for adult ADHD. See, ADHD, we cannot say someone coming to me after 40 years of age and saying, "Ki, okay, I'm having 5, 6 symptoms, Dr. Shobit, 8, 9 symptoms, and I think I'm having adult ADHD." You have to have its roots when you want to do a developing period. Now we have stretched developing period from, I'll just answer the questions. Expansion of adult ADHD is adult attentional deficit hyperactivity disorder, ADHD. Attentional deficit hyperactivity disorder, adult ADHD, we are talking about here. So we also call it sometimes known as ADD, attentional deficit disorder, when we are not talking about hyperactivity. That is very common in females. So females generally they'll report of attentional deficit but not of hyperactivity, like daydreaming, losing task, losing into the background noise. So those kind of things are common in females, but males they generally come with hyperactivity also. Again, we'll come to the chat box subsequently. Now, what I was dealing here was trying to make a point here is that these symptoms should have their origin of birth in the developing period. So development, we say, is brain is developing when you're 16, 17, 18 now. So we long gone the days we were saying that brain would develop till 7, 8, 9, 10. No. So generally we say that it has to have, okay, something was there in your college period, school time, will take in, okay, there is an adult ADHD phenomena. So now these are the symptoms cut off here. Sorry. So these are the symptoms cut off. Like inattention, there are 9, 10 symptoms. Hyperactivity, there are 9, 10 symptoms. And if 5 of them are fulfilling for 6 months, you do not call someone having ADHD when someone is having symptoms around exams, for example, maybe for 1 or 2 weeks, or maybe around any critical point like uh, marriage of a cousin or a family member where you're very overwhelmed. So it has to be persistent for 6 months and in more than one settings just to establish that okay, it is an independent problem. So this is one video. It shows very interesting phenomena. I think people can comment in the chat box. What do you feel like what he is doing? So you can see he's drinking water.
The video is not visible, sir.
Ma'am, is it not visible?
No,
No, we are still being able to see only your first slide of the
the intro slide. That's
yeah.
it.
So you have not, my slides are not.
No, sir. I was just going to interrupt you to tell you that, sir.
Oh my God. Oh, that is why I think the question was asked that what is that? Just a minute, ma'am.
Yeah, you can probably start sharing again and try it, sir.
Is it visible?
Yeah, the screen is visible. You can, now we're being able to talk. Yeah.
See, I actually
Yeah.
prepared the whole question.
Okay. Oh, okay.
We were all responding based on what you were saying, sir. We never thought that it was coming on the screen also. I'm so sorry.
Okay, so these were the questions.
Okay.
Yeah.
This is
Yeah. So yeah,
so
this
how
video,
ADHD looks like.
Now we
These
can
are,
see the videos.
yeah. So this is constant zone out sessions, only fast walking, either life of the party, and they want to go home early and bumping into the people. So this is something which you can see just a casual video. This is the DSM-5 criteria, where I would say that inattention, these are the various symptoms 9 or 10, and hyperactivity, impulsivity, these are the symptoms 9 or 10. So we need a cutoff, and it's and at least we need some degree of symptoms of either of these two clusters, and before or around 12 years of age. So that is why I'm saying that developmental period, and it should create distress. That is important. So that we have discussed. So see this video. This is interesting. What is he doing? So he's drinking water. So he's studying, and then he's looking at the laptop. So what is he doing? Can I have responses? He's also pouring water. Yes. So he's trying to deliberately do two activities together. So he's hooking himself with two activities. Screen looks blank. So is this video visible to all everyone?
Yeah, the
Yes,
video
yes,
is
sir.
playing now, sir.
Yes, yes.
So in is attention span a disorder? Span problem will come to the questions. He's trying to do multitasking, yes, and but multitasking is an issue in ADHD. So see, a lot of engineering students have started to come us and tell us, "Ki sir, whenever I would want to study, I'll open my YouTube or my music instrument, and I'll play music so that I can read." So they are somehow trying to hook themselves to another activity just to sustain their attention. So this is something which is counterintuitive or oxymoronish, which you might find in ADHD. So this is also something very, very interesting. So adult ADHD, you'll find so many explanations. Point of putting this video is this. So this is an interesting video. So they have made it one of the characters is hyperactive, one is inattentive. You can see this. If I speak, the video is pretty fidgety. He's trying to do two or three tasks, not able to complete, using a lot of gestures, being pretty. You can see the heads are the legs are tapping. Then not able to relax, not able to wait. Opening his book, not able to even start it, leaving the space, having difficulty in occupying one space, and inattention one you hardly notice him. And but he's as unproductive as the hyperactivity one. So the problem with inattention is it is largely undiagnosed. It comes with a lot of scholastic issues, a lot of issues with performance in the office or work performance, but it will not be at your face. So again, I'm playing this video, and if everyone is okay, we can go to the next slide. Okay. So the various terms which I think we all should know in order to spread the awareness, which is the whole construct of doing this program, is ADHD, specifically attentional deficit hyperactivity disorder in adults. They have time blindness, so they will not be able to gauge so they might say time flies. They have task paralysis. We have discussed this. This is important. They are hyper focused also. This is basically an islets of excellence which they might find. Ki, okay, sir, he is pretty boisterous. The XYZ person is pretty impulsive, and but he's fantastic in doing his work. He finishes his work, and he would spend very less time on his work, but outscores others. So this is an exceptional quality of the brain, where when there is less time, last moment due to procrastination, they'll actually they'll stick onto a time zone and they execute it. It's like Virat Kohli hitting those two sixes in India Pakistan final, in T20 final, which is a historic innings. And he took it to a very last and did it. So that kind of a phenomena happens in ADHD. Then this is important. They are very sensitive to rejection. So if someone uh, would basically insult them, so they are they get very emotionally overwhelmed. So they are very sensitive to criticism and rejection. They have execution deficits like sustained attention. We have discussed this. starting a task, finishing a task, sustaining a task. So this we have planning a task. Then out of sight, out of mind. So you feel that okay, but this guy is absolutely unemotional. Or this girl is absolutely unemotional. So when someone is there in front of him or her, the emotional balance is there. Otherwise, they would absolutely behave as if the person doesn't exist. And at the same time, it relates to objects also. So they'll frequently misplace their items. Okay, so they're saying that again, getting the chat box, people are saying I'm not sensitive. Is that because they're aware of their condition? Probably yes. Probably yes. Sensory overload, they get very overwhelmed. So when they go into a very noisy environment, they would shut down. Predominantly, which variety will have this sensory overload? Inattentional variety. But when you are hyperactive impulsivity, you will. Yesterday, I got a child with ADHD. Parent says that whenever he goes in front of the doctors, he gets very hyperactive. And his expressions will increase, his movements will increase, his loudness will increase. So they enjoy this sensory overload also. Then decision fatigue. Okay, so if they take too many decisions, they have something known as choice paralysis. So if three, four choices are given to them, they'll not be able to choose what is appropriate or not. And making a decision actually drains them. So they'll try to delay any commitment to take a decision. And all or nothing phenomena, like they'll work in extremes, as which you find in personality disorders. So they'll not work, or they'll not at all focus, or they'll hyper focus. So when you talk about ADHD, so it's not, it's day, the patient, the people with ADHD, the day is not synchronous. It's not a linear line, as if you'll find in many of us, you might not find. They'll be doing intensifying work, they'll have energy crashes, and then they probably re-energize. And this can happen not on daily basis, also on weekly basis also. How it impacts family life. Now, this is important. So I've just put up a case, not one of my patients actually. I've tried to tweak with some of the details of it, and I've changed the identity for confidential purpose. And to put it into a scenario, some details have been tweaked. So this is a Rahul story. Uh, so Rahul, the 30-year-old, he was from Delhi. He's married, and he was diagnosed with ADHD subsequently just 14 months ago, and he was obese, and he would struggle with executive function, time management. He had emotional dysregulation with parenting. How his journey started, let me tell you. When he was young age, he had an academic potential. He was an creative thinker, and he showed flashes of brilliance, but the performance was inconsistent. He would regular get scolded for daydreaming, losing notebooks, talking out of the turn. He was labeled lazy and careless. And he had intense board exams pressure, which led to comfort eating. He went into binge eating, and he would take around maybe for the more than 5,000 calories per binge, and his weight started to increase. And despite him having a lot of potential, which was marked early, he scored poorly in 12th class, uh, termed as poor student by the family and extended family, and barely he could get his passing marks for engineering entrance exam, setting patterns for future struggles. Subsequently, he joined engineering college, which was not a very high profile college. He used to miss lectures, procrastinate until last night, with failed multiple subjects. Overwhelmed by competitive environment and coaching classes, he started drinking whiskey, and he went into substance abuse like cannabis use, ganja use, late night food, street food, and then he subsequently dropped out after 2.5 years of his college struggle. We can see then subsequently he do BPO night shifts, and he was chronically late. He wouldn't report on time. He would miss deadlines. He received warning. Then he joined IIT Gurgaon and IT support in Gurgaon, but he had impulsive arguments with bosses and clients. Incomplete reports became a pattern. Then subsequently became sale executive, and he would not pay his EMIs, will forget his debit card. The deadlines and financial stresses would increase because of his lifestyle, and frequently he would have multiple short-term positions. Persistently, he will not follow one job, and he landed himself into a sedentary desk jobs, which worsened his obesity. Subsequently, he was married thinking कि शादी के बाद सब ठीक हो जाएगा. After marriage, everything will be sorted out by the parents. And he married a school teacher. Wife became family manager and organizer, handling bills, groceries, in-laws' expectations, and all planning. Then he had constant conflicts. He would forget anniversaries, imagine. So we all wouldn't dare to do so. Half done chores, emotional outbursts, time blindness caused. He would miss family functions, kids' schools events. He would, and then subsequently, he was scrutinized by in-laws, subsequent, which is very common in our setup. And he was seen as an irresponsible person with induced shame and withdrawal. He went into binge drinking, driving. Then he was first. Ultimately, things got too much for him. The legal troubles, the financial troubles, and then did his first suicide attempt at 34, and because of his depth and all. And second episode suicide attempt was, and there was a lethal attempt, which happened at 36. Subsequently, the subsequently when he became a parent, so importantly parental struggle started for him, because remember adult ADHD also you carry it to a parenting and marriage. There are the only two courses in life where you don't have any guidelines. Broadly, there is no course for these two courses in life. So you can see he was inconsistently present for his children. He would frequently switch to being over lenient to be very prudent with or he would be very strict with his children. So children would have emotional instability in themselves because they'll become insecure, and they'll have unpredictable times. Always remember, first 5 years of child's life is we call it uh, the time of emotional silence, where you're not supposed to have any emotional turmoil. Otherwise, they hit their brain for their life. And subsequently, children would mirror the inattention struggles of the father. They become impulsive, and he would be subsequently bullied. Then, till the time he came to us, we did his evaluation. We did his review, and he was referred to us by our friend from Delhi, and he improved on stimulants. And my point is, it improved his weight, and it improved his attention. Impulsivity came down with the holistic help. Now, why I have kept this vignette? Uh, because in order to just bring a perspective to the audience that what is ADHD, we had somehow tried to educate the audience here by the help of question answer sessions, because merely reading the symptoms might not have helped, and how it actually can hit your life. So everyone is seeing his or her life in the audience, maybe their family members, the extended relatives, or maybe their colleagues. So that, because cross sectionally it is very difficult to address it, so longitudinally you will be able to know the problem is not with substance, with any addiction, with depression, with anxiety, suicide attempt. Problem is of attentional deficit hyperactivity. But as someone has noted in the chat box, that not everything is bad with ADHD. Now, they are the most energetic. They are the life of a party. They are very creative and enthusiastic. They have great sense of humor. They are very resilient in some strange sense, very imaginative. They are very adaptable in some strange sense. So and they can pick up things because they're hyper focused. They can do things at exceptional speed. The very good thing which you can do with your ADHD employee, or sorry, an employer, if many of you must be employing, are employers also. Do not give them the the window of reporting time and exiting time. Just leave them alone. Give them creative jobs because they'll be able to do it in much more efficient way than the others. So what is the various things which we can do with adult ADHD? I'll not go into the details of medications because they are probably they'll be a little technical on in this forum. What I'll be trying to touch is some basic tips which you can give to them. Having planners, because there's one of the chat box responses was that nowadays because of frequent forgetting of tasks, reminders, appointments, we use planners. I also use planner, and what I do is I'll arrange my planner that remind me before a week, remind me 2 days before, and there are two reminders only which you can put. Then you can do these some apps with to-do list. You can use this. This is Microsoft one. You have various apps, good apps. This is an important technique, Pomodoro technique for children and for the people who have very unrelenting workspace. So Pomodoro technique says that you have to take 25 minutes of a binge work time and give yourself 5 minutes break. 25 minutes of binge work time and then 5 minutes break. And once you cross this four sets, you can take a long break of half an hour. Now, what to do in this 5 minutes break is important. The most of us, when we are unoccupied, we'll be scrolling our reels, chatting on our WhatsApp, and which is unavoidable, let me say, checking our mails or maybe enjoying a match highlights or maybe seeing some recipe. So you have to do these things in these breaks. So whatever leads you to procrastinate, do these things in this break. Then this is the key. Now, many patients will come to us, sir, I'm not able to sit for 25 minutes altogether. How to go about it? I don't want to take medications. How to go about it? So this is a very good rule, which I thought that has helped a lot of patients, is 5 minutes rule. I tell them whatever trash you want to do, just please open the activity for 5 minutes and close it down with equal conviction. So if you are avoiding some task, procrastinating, maybe in homework, maybe in preparation, maybe a seminar or webinar, maybe a review article, a research paper, whatever it is. So please do it for 5 minutes and then shut down your laptop. Because once you are engaged, your neuron, your brain goes into it. So more often than not, you will actually engage yourself into that activity for a sustained period of time. This is important. I would like to have audience responses in the chat box. What is this? Slide. So what is happening in this video?
For I'm impulsive, can you tell something you can tell for impulsive also with the ADHD?
Yes, sir. I'll come to that, sir. So what is happening in this video? So this is constantly multitasking with phone scrolling and laptop. So similar to that one video which I had shown that the person automatically was engaged in two activities just to sustain the attention. This is known as body doubling technique, where because of inattention, you will actually catch someone and do your activity in presence of someone, not doing it alone. Because when you're alone, you're too distracted or too impulsive to carry with one activity. Okay, so maybe have someone in presence of you. So in order to have sustained activity. So here the person who's working in the laptop is actually having attention deficit also, but because she is doing this in presence of some activity, so the other person, she's engaged. So this is known as ADHD priority filter, which I've thought that it is many a times you're so cluttered with so many things, so you're not able to decide on how to go about a particular task. So I'll read it. When everything feels urgent, does this move my life forward? Does this XYZ activity move my life forward? If the answer is yes, we'll go that does this need to be done today? If answer is yes, do I have the energy for this now? If answer is yes, what happens if I don't do it? So if there is a big consequence, do now. minor consequence, do it later or drop it. So this is how probably an ADHD priority filter, or maybe filter for every one of us. Because nowadays with so many, even a WhatsApp response has become urgent. But you have to remember that urgent is not the same as important. So you have to just gauge the importance of an activity and subsequently urgency and then commit to it. You can also do exercises. Exercises will bring down the chaos, the randomness, the oscillations in your brain little calm. So it will actually help you to focus. Eating Mediterranean diet. Fortunately, we Indians have Mediterranean diet, so that is a very good diet to have for the brain. Drinking good enough water, sleeping adequately, because if you're not sleeping properly, you're short sleeper, or you're not sleeping properly, you're not attentive in the day. So you'll be groggy, fatigued in the day. And avoiding sugars, because sugars are or carbs, they're not good for the brain. This review which we have published about exercising mental health, it says 30 minutes a day exercise is good enough for the brain. I'm not talking about the physical health, but for brain health. So these are two organizations where you can go and actually become a member if someone is having ADHD. So this is ADDA, and this is and CHADD is for child and adult hyperactivity. ADDA is for attention deficit hyperactivity organizations. So you can go and join, donate, or maybe contribute to the society. So take home point is ADHD needs to be looked into. People around you, many of them are oblivious that they are having this issue, and it is manageable with some comprehensive teamwork and some practical tools, and if need be, with help of some medications, because it can change or make or break a life. So with this, I'd like to sign off. Thank you. Thanks for the patient listening.
Thank you, sir. A couple of questions in the chat box. I'm just going through them. 1 second, sir. Is attention span problem a disorder? That is from Mr. Raman. And then, so if an adult is diagnosed with ADHD, they must have had it in the teens. And is that because they're aware of their condition? All these questions, so some of them are answered. If you could just cover these points some more. And if someone diagnosed with ADHD and as this disease can end in multiple psychiatric issues, still there are sufferings. Can the person be treated with stimulants or non-stimulant medicines? If you could just answer these, sir.
Yeah. I'll just take it one by one, ma'am.
Yes, sir. Yeah, would you like me to read them again? So 1 second.
One, ma'am. One. I'm having
Yeah,
some.
No. So 1 second. I also have to go back. And one more question. So, okay, let's start with this, which was put first. Are there any tests which one can go through to identify the scale of ADHD?
Yes. I'll share tests. So there is a scale known as Vendor-Uta scale for ADHD. It's a freely available scale, and you can go and it will actually rate your childhood, and it will give you a score where you can see the cutoff, and you can see. Now the problem with these scales is you need an interpreter, you need a clinician to actually interpret your response correctly.
Okay.
So then the error will not be there, because many a times when we throw a scale to a subject or a patient, so generally the scorings are a little higher or depends upon the motivation. So nowadays a lot of engineering students are coming to us and they read in the internet, they fancy about attention deficit, they want some excuses, leaves, or some rebate in their scoring systems, but they don't have ADHD. So that is so you need to also meet an expert to actually gauge each and everything. Within clinical discretion is important. So you need a filter. So to
Okay.
this, if someone is interested, I can share those scales. Vendor Ruta is freely available. There are a couple of more scales. I can share those scales.
Okay. Sir, just to be on the cautious side, if somebody uses the vendor router and tries to interpret it by themselves, would it lead to, or is it possible for a person who is not trained to interpret it?
Yes, ma'am. Because most of the scales you need a clinician along with you to
Yeah.
administer. He's a mental health professional, so that the questions answered and your history, it matches, because many a times scores are overinflated.
Okay.
So there you'll over-report it depending upon, okay, I'm having a severe issue. So you need a discretion in that.
Now, is it freely available on on Google that we
Yeah,
just
yes,
go? Yeah,
yes,
yeah.
yes.
Okay,
I'll
okay,
share you the
okay.
link also.
Because sometimes things which are available so easily on social media, sir, are more misused than properly used. So that is a cautious thing that I wanted to talk about. So the next question is attention span problem a disorder?
See, again, this is an important question. I think somewhere I had addressed it also. Uh, See, anything, uh, see, attention span is ability. See, what is attention? We have to understand. Attention is ability to attend to a particular stimuli. So when you are able to attend to a particular act or task, we call it as an attention. And when you need a sustained attention, we call it concentration. So concentration is when you're able to sustain your attention through an activity. So if many a times, because of many contextual factors, we are able to attend to tasks or concentrate on activities, but many a times we are not able to do that. So that is why we have got a set of symptoms now. So when we talk about inattention, so inattention also they have given 9 set of symptoms in different contexts.
Yeah.
So that you not overdiagnosing yourself. So otherwise, every human behavior you can put it into an umbrella of an abnormal phenomena. So
Yeah.
if 5 of them in children, 6 of them are present, so we call it, and for a period of time, for 6 months,
Yes.
it a disorder. So that is why merely calling attentional span a problem, a disorder will be little far-fetched as of now.
Okay. So if an adult is diagnosed with ADHD, they must have had it in their teens also.
Yes, yes. So that is what I had mentioned, that uh, you have to have its roots in your developmental period when brain is developing. Now, brain develops till 21, 22. So if during your developmental period you are having some shades of the symptoms and it is being dragged till date, then only we will be able to confidently say that you're having adult ADHD. Now the problem lies is where is someone comes to me at 30, recently married, and till now he was alone, a bachelor working in his office, the average performance, and isolated in some sense with his idiosyncrasies. Now after marriage, everything crashes down. So when we are able to take a history, we'll not get much of the history when we go
Mm.
back. Probably the person in context has compensated. He was compensating with his deficits. So and now suddenly the circumstances lets him decompensate. So
Mm.
attentional circuits which were problematic, he because of his adjustments around it, he was compensating. So that
Yeah.
kind of you will not.
Okay. So there was a question saying, can stimulants or non-stimulant medication help a person who's diagnosed with schizophrenia? Earlier had attention issues also.
Yes, yes. So, ma'am, please get to the question again.
Okay, if someone diagnosed with ADHD, and as this disease can end in multiple psychiatric issues, my son went into psychosis, later on was diagnosed with schizophrenia, and he is still suffering. Can he be treated with stimulants or non-stimulant medicines?
See, there are two aspects to a question. Many a times, what we have done is we have given stimulants to our patients with with ADHD, because stimulants would elevate dopamine in the brain. It can decompensate a person into psychosis. And many a times, I've been treating those patients who have been started stimulants by other psychiatrists,
Okay.
because attentional deficit you'll find as I said, in general population,
Yes.
in in crisis situations. So you have to be very, very sure before starting. And the medication should be reserved for patients with or subjects with moderate to severe dysfunctions. If
Hmm.
someone having mild dysfunctions is able to compensate, I generally ask them not to do it. Do some exercise, take some vitamins, and try to just drag it off. You have maintained yourself till 25, 26. How you were able to do it, please
Yeah.
continue that. So take some therapy, but avoiding medications till you are very, very sure. Because
Yes.
occasionally they might, decompensate the subject into schizophrenia or psychosis. But mind
Okay.
you, when you talk about schizophrenia, someone having schizophrenia will not be because of stimulants. Stimulants
Mhm.
will hold the problem lying behind.
Yes. Yes. Okay. Can ADHD present as procrastination without hyperactivity?
Without procrastination and without hyperactivity.
No, no, present as procrastination, but without the hyperactivity.
So inattention variety, you can see. So inattention variety will not have any hyperactivity, impulsivity, and the person, because of inattention, because of not able to take a load, the person will be delaying the task. The person will be,
Mm.
because of the fatigue, that, as I said, decision fatigue or the inertias, person will be delaying the task.
Okay. Thank you. So I think that's the end of the questions. I would like now to hand it over to Saraswati for the vote of thanks. Thank you, Dr. Garg, for being here with us. Over to you, Saraswati.
Yeah, thank you, Sindhuja. Thank you, Dr. Garg. It was a very informative and very engaging session, I would say. It gave us a lot of clarity. Thank you so much for taking your time out on a Saturday morning for our families. And also to all the participants for joining us today. And a big shout out to Sindhuja for taking this forward and organizing it. Thank you very much, sir.
Thank you, ma'am. Thank you. My pleasure.
Yeah.
Thank
Over
you,
to
sir.
you, sir.
Yeah. And the FACEMI pledge. We take this pledge to work towards the vision and mission of FACEMI India, to advocate for the rights of our loved ones and care for the wellness of families with respect, trust, hope, and love. Thank you, everyone. Thank you, everyone, for being here today and joining. I hope more of our families are able to join the subsequent meetings and make it a bigger show. And I think it was a very useful session from my side. So I hope we all continue to gain knowledge and information which would help us to deal with our issues that we face on a daily basis in our families. Thank you for being here. Bye bye. Thank you, Saraswati.
Thank
Bye.
you, everyone.